Dr. Mercia Jane Tellie, who's from South Africa. Thank you.
Good afternoon, colleagues. Yes, it's my turn to present. Let me just share my screen. Can you see it?
Not yet, no, it's not appeared.
Not yet.
No.
Really? Okay, let me close and restart. Share, okay, share, let's see there.
It's just starting up. We can see your screen.
Oh, you can see my screen now.
Yes.
And is that better?
Yes,
can
the UNICER presentation, yes.
Okay. Yes, little bit of background. I'm a nurse by profession, and I live in South Africa. And I work at UNICER now as a lecturer in the health studies department, but I used to work within the HIV field, and that is where my passion has developed for nurses' wellness. As the presentation continues, you will see my interest. Why was it in the wellness of nurses, to keep them well so that they be able to function within the healthcare system. Okay, so the title of my presentation, it's actually Strategies to Mitigate and Manage Compassion Fatigue amongst nurses working on antiretroviral clinics. And this was a desktop literature review. And just the layout of the presentation, there will be introduction, objective, methodology, results, discussion, and then conclusion. Just as an introduction, I think the health of nurses is very important, the health and well-being of nurses. If we look at them as being frontline workers, the public need to have a healthy nurse to be able to deliver quality healthcare services. No. So, but nurses are often, they care for large numbers of traumatized, terminally ill patients, and this really comes at a cost that impacts their well-being negatively.
Part one of a series of OER.
Oops, ooh, what is that now?
Audience to generate solution to one of the key challenges.
I don't know what happened there, why that voice thing came through now. Oh, this is sad. Sorry, I had to stop sharing. I don't know, I used that presentation, the template to do my presentation. Let's hope it doesn't continue this voice thing that is on here. Let me share again. Okay, so as an introduction, we carry the largest burden of HIV and AIDS, and we also have the largest burden of antiretroviral treatment programs. Like we have got about 4.5 million people on antiretroviral, and the demanding nature of care for HIV positive patients comes at a cost that is increasing nurses' vulnerability to develop compassion fatigue. Now, so compassion fatigue is an extreme state of tension and preoccupation with the suffering of others, and that negatively impact on nurses' health. So like I said earlier, nurses are exposed to terminally ill patients. As they listen to the patients' stories, they sort of negatively absorb this negative energy from hearing their patients' stories or witnessing the trauma. Can everybody hear me? Am I audible? Is it sharing?
Yes, you are audible, Dr. Tellie.
Thank you. Thank you. Oh, why doesn't it want to move? Oh, no.
of this OER.
Okay. So what are the risk factors for developing compassion fatigue? This study, actually, I've done a study initially, like I mentioned earlier, I worked in the antiretroviral clinic. And then I've noticed this phenomenon amongst nurses to say that what is happening here really? And then in that study, these are the risk factors that actually came out. Like for instance, they care for traumatized patients. Vicariously, they are exposed to the traumatic experiences of their patients, challenges that are created by the healthcare system, lack of support from management, and overwhelming workload. And of course, this then influences on their personal life and their family lives. Often nurses are infected with HIV as well as their family members. They know of somebody that is infected, neighbors, family members, and so on. So this is really causing some challenges on nurses' health. Now, just some of the warning signs of compassion fatigue. This is just as an introduction. Of exhaustion, emotional and physical exhaustion, reduced ability to feel sympathy and empathy, anger and irritability. They can also start increasing use of alcohol and drugs, dread of working with certain clients, diminished sense of enjoyment of career, heightened anxiety, irritability, and intrusive imagery of their patient's trauma, hypersensitivity or insensitivity, emotional material, difficult separating work life and personal life, absenteeism, and also impaired ability to care for a patient. And so they tend to neglect patients. A person can actually compare this situation in the ARV clinic with what is currently happening in our system. Background noise, is it coming from me? Okay, thank you. It's gone. So if you compare the current situation with COVID-19, the nurses, healthcare workers are really exposed to the traumatic experiences of their patients. Patients are alone, they're dying in hospital alone, they're separated from their family members. So this can be very traumatic for everybody involved in the healthcare system at this current stage. And this is also what it was happening within the HIV field, that nurses are really exposed to their patients' trauma, and this negatively affects them. This quote, the expectation that we can immerse in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to work through water without getting wet. Now, what are the consequences if this nurse then should suffer from compassion fatigue? Suboptimal nursing care, they lose their nurturing ability, nurse-patient relationships are affected, and the nurse in the end might even leave the profession. But the problem statement, like I mentioned earlier, is that I've noticed this phenomena amongst nurses, the fact that they become negligent and they don't sort of care for their patients, and some over-identify again with their patients. So in the ARV clinics, they are exposed to large numbers and terminally ill patients, and this really increases their risk. They tend to face many deaths of their patients. This has improved. The mortality rate has really gone down, but you do still find patients that enter the healthcare system at a very late stage will actually be affected, and nurses will have to witness the suffering of their patients. And then, as I mentioned earlier, as they listen to these traumatic stories, they absorb the negative energies, and this becomes secondary traumatized due to that. So the objective of this paper was really now, okay, so if these nurses have got, these risk factors are within the ARV clinic, and what can we do about it? Because compassion fatigue is preventable. And a nurse can suffer from compassion fatigue at any stage within a career. And if you had it, it doesn't mean you cannot have compassion fatigue again. In other words, you can have multiple episodes of compassion fatigue. So I looked at the situation and thought, okay, what does the literature say about what can we do about compassion fatigue? Because the key is to prevention is awareness. So then this desktop paper or exploration of the literature, I identified a number of strategies that we can actually mitigate and manage compassion fatigue. So just the methodology, like I mentioned, it was a desktop literature search, and I searched from January 2008 to June 2019. I looked at terms like compassion fatigue prevention and management strategies, and also I used specifically nurses as the target groups for these study. So the search engine was Clinical, PubMed, Google Scholar, and EBSCOhost. And the language that I searched for, it was peer review articles and in the language of English. The results, the preliminary research identified around 50 articles, of which only 29 met the inclusion criteria. Some of the articles was not about nurses, so I exclude that. And it was more on fatigue and not compassion fatigue, so I exclude that. Then I also looked at, manually I went through reference list of articles that undertake this search and for additional articles that could fit the inclusion criteria. Doing that, I identified 1 team, 2 categories, and 8 subcategories. So the strategies to mitigate and manage compassion fatigue can be divided into 2. The categories was personal and professional strategies and organizational strategies. For the personal strategies and professional, that was self-care and work-life balance. Organizational strategies, psychosocial support, debriefing, bereavement support, mindfulness training, resilience training, and accelerated recovery program. So, as a discussion, strategies, you cannot just use any strategies. There should be an aim. What do you want to achieve with these strategies? So what I wanted to achieve looking at these strategies, I wanted to promote nurses' individual resilience. I wanted to educate those at risk on how to overcome the negative effect of compassion fatigue, burnout, and secondary traumatic syndrome. Now, burnout and compassion fatigue is very closely related. Some of the symptoms are overlapping. Opportunities for professional development. We should also look at strategies that helps with that. Awareness training on signs and symptoms of compassion fatigue, debriefing, and stress reduction techniques. So on the strategies to mitigate and manage compassion fatigue, then under personal and professional strategies, if we look at self-care, which is a very important intervention that everybody, not just nurses, but wherever you work as an individual, you should take care of yourself. So the self-care is actually the cornerstone in preventing compassion fatigue because it promotes a sense of compassion satisfaction that acts as a buffer against compassion fatigue. Now, the literature has shown that self-care with self-reduction, self-awareness, and mindfulness may be effective in reducing the emotional exhaustion. Because these people are emotionally exhausted due to overwhelming workload, and not just emotional exhausted, but also physically. So what are the tasks that we can actually use to replenish our energy, to refuel, and to revitalize? It includes exercise, relaxation, spending time with your family, adequate rest, eating a well-balanced diet, journaling, and gardening. Take a walk in the garden. That also helps to refresh a person. And journal, write in your journal something about the day and how the challenges you had for the day and how you managed to overcome those challenges. It actually helps a lot. Then if we look at another strategy, which is your work-life balance, Work-life balance enables nurses to spend time and energy into nurturing themselves, and it includes maintaining professional distance. A problem with compassion fatigue is that nurses tend to over-identify with the trauma that their patients are going through. And when they over-identify, there is no boundaries between work and life. They tend to take their work home and so on. So it really is not well for the nurses if they do things like that. And then exercise and eating a well-balanced diet is also part of maintaining your work-life balance. Now, you need to also focus on attention on enjoyable, non-work related activities. On a personal level, like I mentioned, that I used to work in a ARV clinic, and what I used to enjoy is just go and watch a movie at times with the kids, spending time with the children, go and watch a movie to just get your mind off these work-related incidences, and so that you can relax and spend time in things that you like to do. Now, studies have been done on this, and they found that maintaining appropriate work-life balance can help to prevent and manage compassion fatigue. And organizational strategies are strategies that the nurse cannot do much about. I've included this here because it's very important that management should understand. And what came out of my thesis is that management often don't understand that nurses actually are affected caring for HIV positive patients. They are affected. And so psychological support is very important in the prevention of compassion fatigue and as well in the management, because it reduces that compassion fatigue. The studies that was done, it concluded that social support definitely has a place in reducing compassion fatigue. Another study was about peer support of informal debrief, in the form of informal debriefing and mentoring result compassion fatigue and burnout levels were low. In this study, they found that the compassion fatigue and burnout levels were low and compassion satisfaction levels were high. If a person experiences compassion satisfaction, that actually is also like, it helps to prevent compassion fatigue because this person is experiencing high levels of compassion satisfaction. Now, another strategy is debriefing. And debriefing is very important in the sense that it gives the nurses opportunity to actually to talk about the pain and the suffering that they are experiencing while they are caring for these HIV positive patients. It also provides support to manage challenges and demands within the workplace. Within my study, what I found is that even informal debriefing, just talking to a colleague in the tea room about things that are challenging to you, and when you are sharing these challenges that you experience, and then they advise each other, okay, I had this challenge, and this is how I resolved it. So that informal debriefing is also very helpful, because debriefing what is currently happening in South Africa within these ARV clinics is that they have a social worker that is working there. But a social worker cannot take care of the nursing staff or the healthcare workers, because their focus is more on the patients. So the social workers' workload does not allow them to provide this counseling and debriefing to the staff. Now, another strategy is bereavement support. Like I mentioned, they are faced with many deaths. Some of them face deaths on a daily basis of the HIV positive patients. And I think similarly, currently within the COVID-19 in the institutions, this is also what is happening. Every day, nurses are faced with patients dying, and they're dying alone. So they have this, what we call bereavement overload. And in my study, I also found that the nurses, they were really overloaded. And because they have got a lot of patients, they don't get time to grieve properly. So they are really overloaded with bereavement because your patient die, and then you have to move on to the next patient to go care for the next patient. And that is really what is causing them to not be able to grieve. So if management is aware of this, they can actually implement some strategies that they can actually overcome this bereavement overload, like allow nurses to talk about their thoughts and their feelings. That also will help to reduce the risk of compassion fatigue. Like if they can have a memory tree, or just by attending a funeral of a patient so that they can find closure over the death of their patients. And like I said, studies have been done here. Debriefing sessions were helpful in acknowledging grief and loss, and participants had a significant higher compassion satisfaction score compared to those who did not participate in this intervention. Another strategy is your mind-based training. Mindfulness is part of self-compassion and is a cognitive process. It allows for greater awareness of the present moment. They always say, live in the present moment. Acknowledge your feelings, acknowledge what is happening to you right now. And then that will help you to grow healthier and to use more adaptive ways on how you respond to stress. A study that was done on mindful-based interventions may be effective. It was found that it helps to reduce compassion fatigue, burnout, as well as stress. Resilience is another strategy that nurses can use, and the definition for resilience is an ability to recover from or adjust early to misfortunes or change. Resilience helps individuals to positively adjust to difficult situations. This is something that a person can develop over time, but some of us needs help to be able to do that. So resilience provides protections against the harmful effects of caring for terminally ill or traumatized patients by enhancing job satisfaction, lessening anxiety, and improving quality of life. There is a program they call the Resilience Program, and this was developed by Gantry and Baranowski in 1998. And this aimed to educate individuals on the risk factors associated with compassion fatigue and the consequences of stress. Another study was done by Potter et al., and they found improvement in nurses' resilience dealing with negative effects of compassion fatigue. There is a measure that we call it a professional quality of life measure. This was developed by Dr. Stum, and they measure compassion satisfaction, burnout, secondary trauma. And what they found with this resilience training is that immediately within 3 months, there was a decline, a statistically significant decline in the secondary traumatization was reported at 6 months. Another intervention or strategy is the Accelerated Recovery Program, an intervention that was also developed by this group. And the aim of this program is to prevent and manage compassion fatigue. Accelerated Recovery Program reduces the intensity, duration, and frequency of the symptoms associated with compassion fatigue. The study that was done, participants showed reduced signs of compassion fatigue. They reported feeling empowered. They had more energy and an increase in self-worth. So their self-worth was also increased. In conclusion, this paper explored on strategies that nurses can use because they are at risk of developing compassion fatigue due to the demanding nature of caring for HIV positive patients. And these strategies can really be used to mitigate and manage a negative effect of compassion fatigue. Just a little bit of background. I said the demanding nature of HIV. currently in South Africa, the nurses, we call them NIM-ART nurses. Nurses are responsible for diagnosing, initiation of treatment, and management of HIV-positive patients. So this is a new program that they introduced in 2010. So this increased the responsibility that nurses has on their work responsibility. They increased that. Although they just manage uncomplicated cases and then they refer cases to the doctors that are complicated. But also what happened is WHO introduced the new strategy that what they call universal test and treat strategy. So this strategy is patients immediately when you are diagnosed with HIV, they don't consider your CD4 count anymore like before. You can actually start treatment on that very same day. So this increased the number of patients that needs antiretroviral treatment for the HIV or for the AIDS. And this really, they are dealing with long queues and they overwhelmed with work. So this really increased their risk to compassion fatigue because emotionally and physically they are overwhelmed, they are exhausted. Like I said earlier, awareness is the key to prevention of compassion fatigue. So we really need to know of ways, how can we actually make these nurses aware of compassion fatigue. Some of the strategy where management support comes in is that what they can do is they can actually inform nurses during the recruitment process to say that if you're going to work in the ARV clinic, these are the risks. You are at risk of developing compassion fatigue. What they can also do is they can include in the orientation program, they can actually include a topic on compassion fatigue within the orientation program. So these multiple strategies to prevent and measure compassion fatigue are described in the literature. But I mentioned the accelerated recovery program and also the resilience program. That program needs a lot of time. Like the accelerated recovery program is a 6-week program. So it needs a lot of time to train these nurses on it. And then also it needs commitment from the nurses to say that they will attend these trainings on a regular basis. If they don't do that, then it won't really be effective if they just do complete half of the program. And having said that, I believe that you got to nourish yourself in order to flourish. In other words, you have to have energy to be able to, if you want to give light, like nurses are doing, you need to light yourself and you need to energize yourself. And I just want to say, take care of yourself, and with this current COVID-19 pandemic, stay safe. Thank you very much.